Good morning. Today is Tuesday, April 15th. I'm Dr. Yamonda Smalls, Director of Professional Staff Development for Maryland Department of Health's Developmental Disabilities Administration. We welcome you to today's Coordination of Community Services meeting. Before we begin, I'd like to go over a few things about the webinar. All participants are in listen-only mode. There are two options to hear the webinar, by computer and by phone. This webinar is being recorded and will be uploaded to DDA's CCS YouTube channel playlist and to the DDA website. Today's PowerPoint will be available to you for download from the materials section. If you're listening by phone and you email us, we can email you the presentation. During the presentation, if you have any questions, please type your name and your question in the question box here, and the team will call on you to ask your questions at the end of our presentation. And now I'd like to introduce you to Nicolette Paparadamas, DDA's Director of Coordination of Community Services. Good morning, Nicolette.
Good morning, Dr. Smalls. Thank you so much. And good morning, everybody. Today, we will be welcoming Tamla McDowell Amodi, Staff Specialist Community Rehabilitation Programs, to review the DOORS referral application and eligibility process. We're then going to go into statewide themes and trends, where we'll discuss CCS performances and provide suggestions for quality improvement regarding processes such as the comprehensive assessment, notification authorization to participate, waive placements, and concurrent eligibility processes, and more. So afterwards, we'll review the policy and program updates, which will include state-funded initiative, the National Core Indicator Surveys, and self-directed services. And lastly, we're going to wrap up our meeting with sharing some external resources. We'll review the new form to communicate with Maryland Department of Health regarding OTP device issues, participant phone issues, and emergency hour approvals. And then lastly, we're going to give a general overview of the new CRISP alerts. And as Dr. Small said, we'll wait at the end to address any questions. Feel free to enter them into the chat box and we'll call on you to ask them live. So we appreciate your patience and we'll make every effort to address all questions thoroughly before we conclude our meeting today. Next slide, please. And now let's welcome Tamla. She'll be reviewing the DOORS referral application and eligibility process. Next slide, please. Hi, Tamla.
Hi, thank you, Nicoletta, for the introduction. Thank you all for allowing me the time to speak with you about DOORS, the processes that we have, and how we come to determine eligibility. And then I'm going to give you a smidget more about what happens after one determines eligibility. For that part, I won't go into great details, but I just wanted to give you information of what it looks like after a person is determined eligible. Once again, my name is Tamla McDowell Omado, Staff Specialist for Community Rehabilitation Programs. At the end of this presentation, you will have time to ask questions. So if you can follow the instructions of Dr. Small and Nicoletta and put your questions in the question box, I'll be happy to answer. What I don't know, I will get answers for you all. Thank you. Next slide. So once again, we're going to talk about the referral, DOORS application process, how you all can support consumers with applying for DOORS services, and our eligibility process. Next slide. So here we're going to just talk a little bit about the populations we serve and who may be the right fit for DOORS services. Next slide. So DOORS provides services to our adult population, which is considered vocational rehabilitation. Employment services, those are our Marylanders with disability, and they come prepared to be able to go to work and to be able to maintain that work through the supports and collaborations of our agencies. We also service the student population, which is student employment services. we call them SES, and pre-employment transition services, often referred to as PREETs. These services provide the students the opportunity to experience and explore work and post-secondary education should they see fit. The age range for these students is 14 through 21. I'm going to talk a little bit about some of the referral ways for both our VR participants and our student participants. Next slide. So anyone who is looking for that competitive integrated employment and they have a disability or serious mental condition that makes it hard for them to actually find the work and maintain the work can apply for our services. We do have 3 categories: most significant, which is category 1, significant, which is category 2, and category 3, well, we're really not serving that population at this time, but there is a category 3, and those are individuals who have disabilities. It just doesn't fit DOORS standards. With category 1, these individuals have 3 or more functional limitations that keep them from finding and gaining jobs and maintaining jobs, independently. Category 2, they may have 1 to 2 limitations that keep them from finding and keeping a job. And then category 3, I explained that a little bit earlier. So what we do is we gather medical documentations, and I'm going to explain to you all a little bit later about how you can help collaborate with some of our counselors to get referrals done for the DDA population. And then once we gather that documentation, we just review it for those functional limitations. There may be times where we have to go back and ask for additional information to make that determination of the eligibility, or there's other process that we go through, like functional capacity evaluations, or it may be that they have a psychological, other methods of determining the eligibility process. Also, individuals who can benefit from at least 2 substantial services, for instance, job development, job coaching. That is a primary service that our providers must provide to our consumers. But then there's also benefits counseling and training. If you do benefits counseling and training, it should also coincide with that job development, job coaching. You can't just pick benefits counseling and training and think that you can send somebody here to be eligible, or someone can apply to be eligible for services. So it must correlate with that job development, job coaching piece. An individual who is immediately ready to participate in services and they want to work after employment is obtained. So if someone is still trying to make decisions on whether or not working is right for them, that may not be the appropriate time to submit a referral. You just want to make sure that they're ready to go from day one. And a student who is at least 14 years old and is not older than 21 years, so they haven't reached their 22nd birthday, is a good candidate to apply for services. Next slide. So let's talk a little bit about the referral process and how you all or any individual can assist consumers with applying for door services. Next slide. So if someone is being referred from high school or they're a college student ages 14 through 21, they can easily be helped by someone in the school system. It could be a parent, it could be themselves. It can be you all to help them apply for services. Adult 22 and older, it can be anyone they desire themselves. And the way that they will apply is by completing the online referral form. Online application form. And I have the link listed here, so you can always go onto that link and help them apply for services. Just gather a few documentations about their disabilities, what area they live in. It asks about if they have Social Security benefits, things of that nature. But the form is really easy to fill out. It can be done by the job seeker, the student themselves, a parent, family member, medical provider, teacher, anyone that they desire to help them. And we just ask that you allow 10 business days for the nearest door's office to receive that application, to process the forms and schedule appointment. At the end of the application, it will provide a telephone number. I just suggest that you write down that telephone number to contact someone if you don't hear within 2 business days to see where the application stands and how it can be moved forward. Next slide, please. So how we determine eligibility, and I may have gone through some of this before, but I'm just going to go through it again. Next slide. So following the intake appointment, the eligibility is determined within 60 days. And when I say intake appointment, that's when, excuse me, the appropriate person had received that application within that 10 business days, and they gather what additional documentation that they may need to determine what their medical conditions are, if they fit into category 1 or 2. And then they'll have 60 days to determine if they qualify for services. Most likely, if it gets midway and they don't have the appropriate medical documentations, they'll reach out to the consumer. If there is a contact person, say for instance, a CCS that is involved in a case, they reach out to the CCS to try to get whatever information they need to move the case forward. After the 60 days, that person who is determined category 1 will move into individual plan for employment. And the counselors here have 90 days to get that plan completed. On that plan, it looks like counseling and guidance, and that's just the DOORS counselor helping them throughout the process. It may have benefits counseling on there. It may have training on there, vocational, occupational training. It will have the job development, job coaching piece on there. It will indicate that the consumer should continue to meet with their medical providers for their treatment throughout the case. And there may be other items listed on that plan according to what the consumer's need is. Documentation required for that eligibility determination could be in the form of a voice letter from DDA, which will expedite the process for that consumer. DDA proof of eligibility from provider agency. Once again, that expedite the process. So if you have that information handy and you know that you're helping that individual with applying for services, just make sure that when they go to that intake appointment or they have that intake appointment, that information is ready for them to provide the DOORS counselor. Once again, we obtain medical records, psychological evaluations, and there may be a few other documentations that that particular counselor can use, especially for students. They like to look at the IEPs, 504 plans in conjunction with other materials that they may need to determine that eligibility. Next slide. Okay, so our student services and pre-eds transition youth, we will also use their student records. Next slide. So I'm gonna give you a brief overview of what happens after eligibility. And when I mean eligibility, within that 60 days, they have been determined that they are category 1 and they can move forward with services. I talked a little bit about the IPE, the individual plan for employment, and some of the things that could be listed on there. That's done within that 90 days. Once that is approved by their upper management, then that's when they can start making referrals for appropriate services, whether it's benefits counseling. We highly encourage individuals with SSI, SSDI to get benefits counseling through one of our approved providers before they start working, once they start working, and after they maintain stability. Because we want to make sure that the working isn't something that takes away their benefits completely if it doesn't have to, or that they understand that the benefits may be reduced, no surprises. A referral could be for assistive technology. Assistive technology is determined on a case-by-case basis. We do have approved doors providers for assistive technology to service doors consumers that are looking for job development and job coaching through our program. There are different checklists or assessments that these consumers may collaborate with their doors counselor to determine what equipment may be appropriate for them or if equipment is appropriate for them. There's referrals for job development, job coaching, and we'll talk to them about the different providers that we partner with to provide DDA, job coaching, job development long term. And for those who don't have DDA funding, there is short-term job development, job coaching options. We have things as vehicle modification, home modification. Anything that doors offer is done on a case-by-case basis, and the appropriate persons to make those determinations to the services is their counselors, and then those that they refer to do assessments or give advice to what may be needed. After they finish the process with the job development and they've maintained stability on their job, then we move towards closure. And the way we hope that this looks is that the doors counselor, the consumer, whoever the consumer has in their support system, CCS, are all at the table before they transfer over to long-term supports. Or if they don't have long-term supports in place, we just ask everybody to be at the table so that discussion can be had and we can kindly give them resources needed to be able to sustain that employment long-term, whether or not we all in that picture or if we all have parted ways. Next slide, please. Okay, do we have any questions? Okay.
It doesn't look like there's any questions posted at this time.
Okay, no problem. I know I gave you a brief overview of things. It could be a lot. You could go back to the slides and read something and come up with questions a little bit later, or there's topics regarding doors that may not have been discussed this morning, but you have a little bit more questions, need a little bit more clarity to feel free to contact me. My information is on the next slide. You can reach me at my email listed above. Make sure that you do put the period after Tamla and a hyphen in between McDowell and Amado, or the email will not reach me. You can always give me a call at that number. Just ask that you give me at least 48 hours, business hours, to get back to you if for some reason I'm away. I do pretty good with making notation on my email. I can't promise that I make notation on my actual voicemail, but I'll get back to you as soon as possible. Next slide.
Thank you, Tamla.
You're most welcome.
We really appreciate our partnership with Doors, and if we hear any questions, if they're not directed to you and they come to me, I'll reach out to you accordingly as well, all right? So thanks for your time. We really appreciate it.
Thank you, and you all have a great day.
You too.
Thanks.
Alrighty, and just as a reminder, these will be posted on our DDA CCS website, including the PowerPoint slides. So if you wanted to review them today or refer to them if you need be, you can search there or even just reach out to me. That's fine. All right, next we're going to be talking about statewide themes and trends. To discuss some of the CCS performances and trends that we're seeing and some suggestive strategies. First up, we have our Division Chief of Eligibility, Ama Owasudanka, and she will begin with some eligibility updates starting with comprehensive assessment. Ama, good morning. Thanks for coming and joining us today. Good morning. Thank you, Nicolette, and good morning, everyone. So first up is comprehensive assessments. Comprehensive assessments should be individualized. CCSs are encouraged to carefully review all comprehensive assessment narratives before submission. Please do not copy and paste from other participants' information. Ensure all information only describes the assessed individual. Please note that any assessment which includes the identifying information of another participant is a HIPAA violation. Once submitted, the assessment cannot be edited. Next slide, please. I want to talk a little bit about notification authorization to participate. So the notification authorization to participate is the only authorization to participate, or ATP, that the coordinator of community services create in LTSS Maryland. The CCS submits a notification ATP to alert the DDA regional office staff that an individual that is currently enrolled in the waiver program is deceased, admitted to a long-term care facility, have moved out of state, has declined waiver services, or no longer receiving DDA services. Next slide, please. When the DDA regional office staff receives this notification, authorization to participate, or ATP, in LTSS Maryland, they will confirm the information submitted is accurate and will submit a disenrollment ATP, or authorization to participate, to the Eligibility Determination Division. Next slide, please. Here are some important reminders about the Medicaid waiver application and the waiver packet documentation. So always submit current documents for the correct person. Submit full documentation. So if a document is 10 pages long, we want you to submit all 10 pages. Include complete meeting minutes and meeting participants. And we have a template of that that's available on the DDA website. And we have provided the link to that template that's currently on the website. Next slide, please. We have started to see applications submitted without waive placement. Individuals who are denied enrollment or are disenrolled from any of the DDA operated Medicaid waiver programs must be added to an LTSS Maryland waive before reapplying. A new waiver application cannot be submitted by the coordinator of community services for an individual unless they have been added to an LTSS Maryland waive. So we are encouraging coordinators of community services to reach out to the regional office if an individual wants to reapply, or if the individual has been globally deactivated and would like to be reactivated. Next slide, please. And I'd like to turn this over to Nicolette. Thank you, everyone.
Thank you, Amma. So we'll be talking a little bit about monitoring and follow-up. Just one update, we wanted to acknowledge that if a self-directed participant is authorized nursing services and they lose their nurse at some point during their plan year, please remind our coordinators of community services to work with the person and team to ensure a new nurse is quickly identified. And monitoring and follow-up requires that CCSs are ensuring that participants are receiving the services identified in the current PCP. And if there is a change in any provider, that CCS should follow up and close the loop when that remediation is identified, right? So this also supports the timely submission of the participant's annual person-centered plan as well. Next slide. We'll be going into policy and program updates, and we will be starting off, Kathy Marshall, our Regional Director for the Western Maryland Regional Office, is going to kick us off with our state-funded initiative. Kathy, good morning. Thanks for joining us today.
Good morning. Can you hear me okay, Nicolette?
I hear you loud and clear. Thank you, Kathy.
Okay. Next slide, please. First of all, I would like to thank all the CCSs who have been helping families submit their applications. As of this morning, we sent out a little over 600 letters, and we already have 158 applications in. So thank you so much for working on this project. So as coordinators of community services, you need to contact and support individuals enrolled as state-funded and developmental disabilities eligible and applying for the DDA-operated Medicaid waiver program. And that's in accordance with COMAR 1022-1204 and 1022-1211. Please note, if an individual is supports only eligible, when you're looking at DD eligibility versus supports only eligible, an individual that is supports only eligible is not waiver eligible. We have received a few applications. If you really feel this person is developmentally disabled versus supports only eligible, please find the documents and send them into reconsideration for the regional office. Next slide, please. As a CCS provider, you can do a report from LTSS, and it will be CCS claims and state payment status report to track individual participants who are enrolled in the state-funded program. Participants received a letter from the regional office. If you have determined that the individual you're supporting has not received a letter, please contact your regional office. Some individuals did not receive a letter because they already had a waiver application in process, or they had had a waiver determination completed in the last 90 days to 6 months. So please do the 2 checks. Make sure the individual is developmental disabilities eligible, not supports only eligible, and that they had not had a waiver application submitted in the last 6 months. If you still think that individual needs to get a letter, contact your regional office. Next slide, please. Encourage and support your applicants to submit all required documents. Out of the applications that have been submitted so far, the number 1 reason that the application has not been processed is all the documents were not included. The second reason is additional documents were requested and they were not received. So please make sure, and Alma just covered the waiver application process, and even those blank pages need to be included. While you're working with the individual, you may recommend additional resources such as an ABLE account or a trust fund if the individual feels they're going to be overscale. If a participant refuses to complete a waiver application, please include the details in your activity notes. I've already seen some excellent activity notes where during the monitoring and follow-up, the CCS again offered assistance to apply for the waiver, and I've seen actual quotes from families on why they're not going to apply. If the state-funded annual person-centered plan is due, this has to be completed and approved before you do the initial plan for the waiver. If the monitoring and follow-up form due date changes, please use the add button to continue with your quarterly monitoring. Please note the Office of Eligibility Services is not prioritizing the state-funded participants. We have a separate checklist and spreadsheet that we are working with EDD, but they're not prioritizing those over other applications. Okay, thank you.
Thank you, Kathy. Appreciate it. All right. Next slide, please. All right. As you all know, a participant's LTSS Maryland profile is utilized by authorized users to send out communications. This includes the National Core Indicator Surveys that Liberty Healthcare is completing on behalf of the Developmental Disabilities Administration. During monitoring and follow-up, coordinators of community services must check and make sure the participants' demographic information is accurate and current. This includes the participants' representatives, such as their primary caregiver, their family members, and when applicable, the participant's guardian. The following reminders is not an exhaustive list, rather it's recognized areas that we would like to remind agencies of. Next slide, please. So please ensure of the following. The relationship to client section of the representative contact form must represent the representative's relationship to the participant, right? So it'll say mother, father, sister, brother, aunt, etc. All forms of contact should be included, such as the email, a working telephone number, and their full address. Please make sure the spelling is correct, as these are directly pulled to use to send communications. So for example, I listed some examples here, right? So what would be correct is the full 1234 Abbey Road, Liverpool, Maryland, 01234. What would be incorrect is 1234 Abbey Road is missing, right? And then the city, Liverpool, is missing. So we want to make sure it's all fully, oh, and Abbey was spelled incorrectly. So we really got to make sure it's spelled correctly, it's full, so that the letters could be received by representatives and people too, and our participants as well. Next slide, please. Just a little bit about what it looks like. Within the representative contact form, you want to check the change in status box to mark the representative's information is inactive, right? So it will inactivate that representative's profile. You would click this when the same representative is listed multiple times, or if they're no longer involved in the participant's life, such as if they're deceased. Next slide, please. We'll be talking about self-directed services, the wage exception form process. Unfortunately, Christy is out today, so I'll be supporting my colleague here. We wanted to let you know about this process, that employee wages and vendor rates must be within the DDA's established reasonable and customary standards. Participants with the support of their team may request an exception to the established reasonable and customary staff wage range standards up to no more than the established exception rate. And then we have linked the wage exception form. That is what needs to be completed in order to request a wage exception. Next slide, please. And just a reminder, the wage exception forms are not to be completed annually. They are a form that stays within the employee during their employment. A new wage exception form would only be needed to be completed if there is a change in rate, if there is a new employee that is hired, or if the participant changes FMCS providers. Next slide, please. And now we have Marianne Bresci, our Director of Family Supports, and she will be reviewing some resources outside of DDA that'll help CCSs with providing participants non-DDA resources. Hi, Marianne.
Hi, good morning, Nicolette. Good morning, everyone. Yeah, so each month we spotlight DDA's comprehensive, although not exhaustive, list of key statewide resources, supports, and services that are available to children and adults with intellectual and developmental disabilities, as well as their families. And we do this on our website. These resources are designed to assist individuals across all stages of life, empowering them to live their best lives. The supports and services featured are provided by government agencies, nonprofits, and private organizations that serve communities throughout the state. They're organized according to charting the life course life domains, which include daily life and employment, community living, safety and security, healthy living, social and spirituality, advocacy, and community engagement. Today, we're going to focus on the safety and security domain. Some of the key resources in this area include, or you'll find, Disability Rights Maryland, Maryland Department of Human Resources Emergency Food Program, and temporary, temporary cash assistance, Adult and Child Protective Services, as well as United Way's 211 helpline. But we'd also like to highlight another incredibly important resource within this domain, and that is supported decision making. Um, I'm not sure if you all know, but I hope you know that in October of 2022, Maryland enacted the supported decision-making law. This law allows adults to receive support in understanding and making their own decisions without giving up their rights. Supported decision-making is a powerful tool that promotes self-determination, autonomy, and greater control over one's life. To learn more about supported decision-making, please click on the Maryland Supported Decision-Making link in the PowerPoint, or you can visit the Safety and Security section of our Maryland State Resources. Also, you can explore the Resources section on the Maryland Developmental Disability Council's website. As you explore these resources, please share them with the individuals you support, their families, and their teams. Raising awareness about options like supported decision-making helps to ensure everyone has the opportunity to make informed choices and lead empowered lives. Thank you, and I'll give it back to you, Nicolette.
Thank you, Marianne. Just a couple, I wanted to let everybody know too, again, if we recognize those domains that Marianne reviewed, those are the same domains under our focus area of exploration in our person-centered plan. That is the FAE, which is the tool in our person-centered planning to understand the individual's needs, goals, and visions for their good life. So you could absolutely add any of these resources under that section of the person-centered planning plan. And additionally, as we're talking about supported decision makers and, and the representative contact information, that could be something that you enter into that section as well. Excuse me. All right, if we could go to the next slide, please. We have Debbie Balea, our CCS lead from our Eastern Shore, and she has some resources as well that could support participants. Debbie, thanks for joining us today.
Thank you. Okay, happy rainy morning for everybody. I wanted to share some resources. I sit on the local coordinating teams for the 9 counties of the Eastern Shore, and I received some pretty good resources. This is for your toolkit for specifically waiting list people for things like discount prescription cards, prescription assistance, things like that. So I just included the links for those for you to share with your CCSs. Additionally, there's help with needy meds, finding free clinics, understanding people's healthcare options. There's an additional prescription hope, which could, for maybe some of your, and this is just not for our individuals, it's for their families. It's to try to help people prevent crisis or in needing it. If someone, all they need is some prescription assistance, they really don't need to come into our program to get medical assistance. They can look at some of these resources. Another one that we deal with frequently is mental health resources. This is a website that was shared by the LCT to try to help families and individuals find local resources, etc. So I'll continue to share with you guys information that I get that is both region and statewide from the LCTs to just help with additional resources.
Thanks, Debbie. If we could go to the next slide. Here are some of the other resources Debbie was relaying, the Patient Assistant Program. In one of these, the Patient Assistant Program, what's included is a national financial resource directory, which helps individuals quickly generate a list of national and regional resources that are dedicated to improving their access to quality care and decreasing that financial burden of medical treatment. But that was an awesome resource as well. And the next slide, again, were some other resources for prescriptions, clinics, and healthcare needs. And then the next slide is the mental health resource that Debbie was discussing. So thank you so much, Debbie. These are wonderful, wonderful resources. Yeah. Next slide, please. All right. So LTSS Maryland announcements. As you know, you receive them in your email address, in your emails, and those emails are associated with the LTSS Maryland accounts. And any of these announcements can be found on the LTSS Maryland homepage as well. So just for reference, if you wanted to go back and check there. Effective on March 2025, Maryland Department of Health launched a new LTSS Maryland Provider Portal Billing Support Contact page. For our coordinators of community services, this is what they should use, this new form, to communicate with Maryland Department of Health regarding OTP device issues, participant phone issues, requesting, right, new OTPs, and emergency hour approvals. And as I stated, this form is used to request those additional OTP devices that are mailed to your organization. So effective immediately, this new form replaces the MDH LTSS billing email and the case manager communication Google form. This form will enhance communication, improve efficiency, and improve MDH's ability to quickly gather essential information. So please note, again, that previous Google form is no longer available, but MDH did retain all of those previous submitted forms. So support planners, case managers don't have to resubmit those. Please note, though, that, next slide, actually. To use this form, please select the option under type of issue. And this is what it would look like. So when you're in the form, this is that area. It'll say type of issue, and you would click case manager communication form. Next slide. And then, oh, sorry, previous slide. This is where you would select, for example, what are you reporting? Here we have the example of how you would request or select OTP request. And it would go that there's a drop down accordingly for any of the reports or requests that you need. And it's as simple as that. Next slide, please. So on Friday, April 11th, the LTSS Maryland Spotlight released a communication outlining upcoming system updates. These updates, all of the updates that were released for April, we're going to be reviewing them in detail, including the CRISP alerts, during our next CCS monthly meeting on May 20th. However, since we've already begun receiving a lot of questions from CCSs, particularly regarding the new CRISP integration, we wanted to provide a general overview in advance. Please note that no action was required at this time, and additional guidance will be shared as it becomes available.
CRISP is Maryland State Design Health Information Exchange. It's collecting health-related data for over 4,000 reporting entities, including all hospitals in Maryland and surrounding areas. The system is designed to enhance communication and coordination among healthcare providers, especially during critical transitions, such as hospital admissions and discharges, transfers between facilities, emergency room visits, and deaths. And as part of this update, the assigned coordinator of community services will receive an alert when a CRISP event is imported. This is nightly, and this alert will include a hyperlink that opens into a new tab directing the user, the CCS in this event, to those event details. But again, this was just a general overview, and please inform your teams that there are no required actions at this time, and we will provide more information once that becomes available. All right, next slide, please. As you know, any agenda topics, questions, details about presenting your agency's accomplishments, any ideas for the next meeting, please send them over my way. We love to hear from you. Your feedback matters the most because this is your meeting. So here's my email if you don't already have it, and please send me your recommendations. And with that, our next slide, we are closing out with questions. It looks like we have an hour and 10 minutes. I think it's allocated a good amount of time. So Marissa Mayton, our CCS lead in the Western Maryland Regional Office, is going to help facilitate our questions. She'll be calling on you to address them out loud. Marissa.
Sorry. Nicolette, did you want me to read the names or just the questions?
If you can call on, if you could call on the person asking to ask their question.
Caitlin Bishop is first.
So it looks like Caitlin's asking to walk through how to complete an authorization to participant submission. Caitlin, I would say that there are two ways. One, feel free to reach out to your regional office if this is your first time. Two, in our LTSS user manual for CCSs, there are detailed instructions on how to do so. The next question from Caitlin from Slide Medicaid. Right. Okay, you're just clarifying. All right.
Next is Rosemary, and I know she asked a few questions, so would you like her to do all of them at once?
Yeah, Rosemary, go for it. Good morning. They might need to be unmuted. Let me see what I can do here. Allow everybody to unmute. You should be able to unmute yourselves now.
Good morning. Good morning.
Good morning.
So my first two questions had to do with the information that you shared on the regional offices sending out state-funded letters or letters to people who have state funding. So a couple of questions here. One, did that letter go out to people who have state-only PCPs, or did it go out to anybody who is currently showing as not in a waiver?
No, it only went to individuals that have 100% funded state plans and are DD eligible.
Okay. And then was a copy of the letter uploaded into LTSS?
Yes.
Okay. And can DDA share an example, a template of the letter that was mailed out with CCS agencies?
No, no. If you can look at one of your participants and check the letter in LTSS.
Okay. Hopefully we'll be able to find that. Um, and my other question has to do with the wage exception forms. So we are experiencing reviewers who are asking CCSs to upload approvals of wage exception forms, which CCS agencies never received. And so I'm wondering if you can tell us what the reviewers are looking for, um, and I guess what prompted this, or where is the where is the guidance that says that people have to now prove that they had a wage exception? What is the outline? What does that look like from the perspective of a person who is self-directing their services, who has a wage exception on their roles?
Sure, Rosemary. I will take this back to the team and get back to you on this. I'm understanding that the regional offices are requesting for an approved wage exception form, and that more guidance would be needed.
Yeah, they're asking for a form, they're asking for an approval that was never communicated to CCS agencies. So we don't have anything to give to them. So it's holding up PCP approvals.
Okay. Thank you.
That's it.
Alrighty. Thanks for coming. And thank you for your questions. All right. Now, Marissa, who is next?
Next is, I think Bailey Famba. I can read her question. It says, what is the process for disenrolling an individual who a CCS has not been able to reach? Also, how long can DDA keep a waiver disenrolled person in LTSS before permanently removing the person from LTSS?
How would you like to answer this?
Yes. So to request for disenrollment, you would need to submit a notification ATP, and that would be the process to alert the regional office to submit a disenrollment ATP for EDD to process. And to your second question, once we have that notification ATP and the disenrollment ATP is submitted, our Medicaid partners will work on completing the disenrollment ODF or overall decision form, and that would disenroll the person from the waiver. I hope that answered your question.
Thanks, Amma.
Next is Kiana Huxtable, and she also asked a few questions. So Kiana, if you want to ask them all at once.
Sure. My first question is in regards to the reason a annual plan still needs to be submitted for state-funded participants instead of just the initial for the waiver. Just explaining that to participants would be helpful.
Yeah, so you are.
Because
Oh, go ahead, Kathy.
because if they don't have a state funded plan, there is no funding. And because the initial plan you're submitting is for waiver services. So until they're approved for waiver services, if there's no state funded approved plan, there is no way to fund their services. Does that make sense?
It does. I guess my confusion is, isn't the state-funded services ending? So how would the annual go into effect?
Once they are approved for waiver services, then that plan will go into effect.
Okay. Okay. And then my second question is in regard to self-direction, and the purpose of the wage exception form being completed when a new employee comes on board. Just the reasoning for that.
I'll have to get back to you on that one unless someone else at the DDA team knows why.
Okay, that's fine.
All right.
Thank you.
Sure. Mm-hmm.
Next is Chrissy Peterson.
Hey, good morning. And I know, so this wasn't addressed at this meeting, but last meeting, I know there was mention about an updated PCP checklist for CCS agencies. And so I just wanted to follow up to see if we had any update on when that would end up rolling out and what those potential changes would be.
Yeah, thanks for your question. We have no update on that. However, as we have done when we are ready to submit it, we will first send it to the CCS COP to provide feedback. So it'll be the same process as we have done in the past, and I'll connect with the COP.
Thank you.
Mm-hmm.
The next two are self-directed questions, so we might have to get back to them. But next is Darwin Amaya.
What would you consider proof of wage already approved the old way for SDS PCP submission? I'll write down your question, Darwin, and I think that was all you had. Okay. Darwin's asking, what would you consider proof of wage already approved the old way for SDS PCP submission? Darwin, do you want to ask that just so I could get a little bit more clarity and be able to take back your question to get it answered? What I can recommend is looking at the SDS guidance. I know that there are examples listed, and that is posted on our SDS website at DDA. All right.
The last question is Jennifer Pritchett.
Yes, hi. I was wondering if during one of the meetings that in the past that I guess DDA had and how they're going about with the changes for self-direct, they did kind of indicate that the CCS will eventually need to be certified in self-direct. Is that something that we're moving towards? They did indicate it, but they didn't say that it was definite. I was just curious.
Yeah, no problem. I know I am not familiar. Again, we can get back to you on that one. And
Can I bring up an LTSS issue? Is that possible? So, one of the glitches now, when a time frame is overlapped and you typed in your billing and then gives you that error, it gets rid of your entire note.
did you submit a ticket?
And no, it just started happening, so I'm going to do that. I was just
Yeah,
bringing that to everybody's
it's the first
attention.
I'm hearing of that. And if anybody else is also hearing it, please reach out. As you know, there is a new LTSS email for submitting tickets. Please utilize that. And since this is send me a forward with that ink number, send a screenshot, and I'll be sure to follow up on it.
All right, thank you.
You're welcome.
Musat is next.
Good morning, everyone. I just wanted to confirm if the due dates for the DDA state-funded participants changed. Like we've seen that a majority of our DDA state-funded participants monitoring have changed from quarterly to annual, and we are unable to, enter information in the previous category. So are we also adding the button, or how? What is the workaround for that?
Right. So as we were discussing on the state funded slides, because of that reason that you're stating, if that due date is changing because they're being added to the wave to apply while they're already receiving state funded, use the add button functionality and continue those quarterly visits. So it'll be the quarterly due date, which is associated with the annual plan date, right? Which should still remain the same when you're applying for the waiver. And then use that add button functionality accordingly.
Thank you.
This isn't a question, but Marianne sent that Parents Place of Maryland is offering a training for professionals on supported decision making on the 30th, and she sent the link. I'm not sure if everyone can see the question box, so we might have to send that link out to everyone.
Thank you.
Next is Jolanta Stoops.
Good morning. I have a couple of questions regarding state-funded plans. So due to back and forth errors what we have experienced with state and in general waiver plans, the question is, if person has auto-extended plan, which is state-funded plan, can provide their bill from that? We hear different answers.
Is this a state-funded plan because the person it was waiver disenrolled?
No, person never has been in a waiver. It always has been state-funded plan.
So are they DD eligible or are they supports only eligible?
They are DD eligible.
Okay, so they need to submit a waiver application. Have they done that?
I'm not talking about waiver application. I'm talking about plans we're still trying to get through from February, January. Can provider continue billing in auto-extended plan? Or the question is
Why
focusing
don't they have a current plan?
because of LTSS glitch, what was going on for a couple of times, and we have to reduce these plans because plans are already in auto-extended status. But the
You
general
need to work with
question
your
is,
regional office. You need to
or,
work with your regional office if you're having a glitch in LTSS.
I'm asking, can provider bill if there is an auto-extended plan, state plan?
I'm not sure I understand what you're asking.
Person is receiving services. Person always has received services, let's say supported employment. We have failed to complete a plan in timely manner. So plan state funded is in auto extension. Can provider bill from auto extended plan?
Yes, they can.
Or some providers say they cannot. And second part of the question is, can provider drop services just because person is in state funded and always has been in state funded services?
They have to submit an involuntary discharge to the regional office.
Thank you. And may I ask a second question that's related to addresses in LTSS? We have changed addresses to reflect the new place where people live, and some addresses keep reverting back to the old address, and it is happening for years. So we really don't know how to fix the tether. We have communicated with regional office, we have communicated with EDD, and some addresses keep reverting back where they used to be, back to MMIS.
Yeah, because of the nightly override through MMIS. So that would be through, if you're communicating with EDD and you're not getting it, I know that another option is going through your local social security office, if I'm saying that correctly, because it's associated with their medical assistance. So whatever their medical assistance address is, that would be nightly, it would be updated nightly until that is corrected if it's not no longer the correct address. So that's why we say go with EDD, because they work on that Medicaid assistance number. But the alternative is going to your local Social Security office.
Thank you.
You're welcome. I did see some hands up. I don't know if and now they're down, but if you wanted to address anything, please go ahead. Go ahead, Rayshon.
I eventually dropped it in the chat. Back on these PCPs for those state-funded participants, I just wanted to clarify. So there are some that we had already done initials for. I think we eventually got a response from regional on that to try and do the annual and then the initial, which is fine. We're good with doing that. But there are some that the initial was already submitted and approved, and we were in the process of, doing the annual when that came. Are those still able to be approved? Is that fine? So I'll let you answer that, and then I'll do the follow-up to it.
Yes, because if there's not an approved state-funded plan, there's no way to fund the person to continue services.
Okay, just wanted to make sure that wouldn't be an issue or conflict for the provider being able to bill. So that's fine. And then what is the plan or the process for those that we are doing the initial for, but eventually if they're not waiver enrolled within a certain time frame, they're going to hit their annual window. So is that then we'll just be doing annuals for those, and those should be able to be approved until whatever period of time? And then what are we doing with the people who
Yes.
end up not being eligible? So those state funded plans that are initials, if they're approved, you get what I'm saying? So would we be doing something for those initial plans that are in the water? I'll say it that way. They're kind of in limbo, meaning the person is not going to be eligible. Is there any plan to disenroll people altogether, or they will just remain state funded and be fine? Do we know that?
Well, if they're not in the waiver, they can't be disenrolled. You can only be disenrolled from the waiver. Right now, we're concentrating on getting applications in. Like I said, we sent over 600 letters and we have 158 waiver applications in. So right now, we really want you to concentrate on getting the MA applications and initial plans in.
Okay. Which is still the case. There still going to be some that who will not be eligible, but they're willing to comply with process. Just it's a known fact. So just wanted clarity around what, because they're asking
Yes, you're right.
questions for
That is a
providers. So yeah, that's
yeah,
just
Sean,
something to
you're
put in the
right.
water. Okay,
It's a fact.
no problem. Thank you.
Sat had another question.
Yes, I apologize if this was already stated, but I just wanted to know if there were any updates regarding the BP Standing Committee training for CCS agency.
I think there is a general behavioral plan guidance that is being developed right now by our clinical director, Dr. Meg DePasquale. In regards to standing committee trainings, you can continue to email her to inquire. She unfortunately returned back. She was out on some leave, so appreciate your patience with that. But if you want a standing committee training, please reach out to her and inquire if there is one.
Okay, so if we have PCPs that are kind of like in limbo due to the signature pages, do we reach out to the regional offices for guidance?
So if you're talking about a standing committee to review restrictions within a behavioral plan, then you would need to work with your regional office to have that behavioral plan reviewed for next steps.
Okay.
That's it in the chat box. Bailey Famba has their hand raised.
Haley, you could go ahead unless it was an accident. Just let us know or put your hand down. All right. Okay. If there are no other questions, we will close out our meeting today. Again, thank you. I will get back to all of you. Again, I apologize. Please refer to the self-direction guidance that is on our DDA website while I get back with Christy, our SDS director, on some of your other questions. And I'll get back to you as soon as possible. But I'll work with her first. Unfortunately, she is out right now, so appreciate your patience again there. But without further ado, thank you. Again, this will be posted on our DDA website, CCS partnering with CCS webpage, on our YouTube channel. We'll also post our PowerPoints too on the webpage. And again, really appreciate your time and patience and questions today. And if you think of anything else, you can reach out to me and your regional offices. All right, everybody. Thank you. Take care. And I'll be speaking with you soon. Bye-bye.